Hi, everyone. I'm Kelly Grant, Vice President of Business Development and Admissions at Caron Treatment Centers. Welcome to the third installment in Caron's signature program virtual open house series, with today's session focusing on our Ocean Drive program. Before we begin, we have a few quick housekeeping items. We are conducting this session in webinar format, meaning you can see and hear us, but we cannot see or hear you. We'd love for you to interact with us though, so please use the Q&A feature in order to ask questions throughout. Time has been allotted at the end to answer your questions. For the clinicians in today's audience, we are not awarding CEUs for this particular session. And lastly, we are recording it, so a link will be sent to you after the presentation to watch later, and you're also welcome to share it with colleagues, patients, and families. Caron's signature programs address the unique clinical, medical, and psychological needs of certain populations that require specialized concierge level of care for both substance use disorders and mental health conditions. At the core of these programs is our highly credentialed team who provides evidence-based, fully customized care that elevates patients and their families to achieve the best possible outcomes in recovery. Signature programs also feature deluxe accommodations as well as ancillary services that contribute to a safe and comfortable treatment experience. Caron's Ocean Drive program in Florida offers robust, innovative treatment and ongoing support that transforms the lives of our patients and their families. And this highly personalized, reparative, and psychotherapeutic program enables patients to fully address their unique issues with others who share similar life experiences. Today, we'll meet some of the expert staff who work with our Ocean Drive patients. But first, we want to take you inside the program virtually to get a firsthand look at our facilities and the philosophy behind this innovative program.
I'm Phoenix Adams, Senior Vice President of Signature Programming. I've been with Caron since January of 2012, and since I joined Caron, I've had a variety of positions within the organization. I oversee all of the Caron of Florida programs, including Caron Renaissance and Caron Ocean Drive, as well as the older adult program in Caron, Pennsylvania, and Grandview Men's and Grandview Women's program. Caron of Florida has always been known for the intensity of its family work. Ocean Drive sees a variety of different types of patients that come from families of wealth, that come from families that are well established in their careers or their businesses. They might have generations of family business, or they might have quantifiable success in their careers. They might come from the medical profession, the legal profession, from the entertainment world. And with that comes a lot of unique issues that our therapists need to be certified in handling or experienced in handling. We do see a lot of patients that come in with underlying trauma, so our trauma program is very important. We do have therapists that have certifications in different modalities of treatment for trauma, as well as different personality disorders and family of origin issues. We found what makes our program at Ocean Drive very successful is that we create an environment for individuals to have treatment with like-minded individuals from similar backgrounds and similar experiences. With that also comes a need for confidentiality and privacy that Ocean Drive is able to offer to our clients. Caron Ocean Drive has two separate and distinct residences that are separate from our clinical offices. This is really important in terms of our model of treatment because it affords our patients the opportunity to decompress after hours, and it's very important because they're spending their day almost as if it's a very clinically intense work day. There's executive chefs to take care of the cooking, there's housekeepers to take care of housekeeping, so other needs for our patients are attended to so they can really focus on the robust clinical aspects of their program.
Hi, my name's Josie Tynes. I'm the Executive Director of Caron of Florida. I've been with Caron since 2014. I love working for Caron because of the intensive family work that we get to do, especially at Ocean Drive, as we'll highlight a little bit today. The clinical philosophy of Ocean Drive is really life on life's terms. We want to have every client and their family member experience as much as they can under our roof while they're learning how to live in early sobriety. We utilize a Florida model of treatment, and what I mean by that is having clients go into the community and go on approved outings. We want to set our clients up for success in their aftercare programs by allowing them to have as much exposure safely and clinically appropriately as they can during their treatment stay. One of the things that I love about Ocean Drive is the ability to treat a multitude of issues. So mental health issues, substance use disorder, any kind of process disorders or process addictions. Part of the philosophy of Ocean Drive is to have like-minded individuals in a treatment milieu together so that they're able to process issues unique to the Ocean Drive population in a safe and supportive environment. The Ocean Drive treatment team is a multidisciplinary team. There are a multitude of therapies that are offered at Ocean Drive: cognitive behavioral therapy, dialectical behavioral therapy, DBT. We have EMDR, ancillary providers such as therapeutic massage, breathwork, Reiki, yoga. Family involvement is important to the treatment process for our Ocean Drive clients because we truly believe that individuals are not created in a vacuum. And what I mean by that is individuals that come into Ocean Drive as clients have a multitude of experiences from their family of origin, their current family systems, their relationships. All of the family members that are involved in an individual's treatment also have experienced a variety of issues. Family members are involved in treatment through calls with the clinical team, their family therapists, through WebEx sessions. We also have the ability to have in-person family workshops.
I am Dr. Barbara Krantz. I'm the Director of Addiction Medicine here at Ocean Drive. Our medical team has diverse medical experience and credentialing, and between us, we have 100 years of experience. Well, psychiatry plays a very important role in the treatment of the patient. It's part of our initial assessment of the patient. It's not just the addiction medicine assessment or the neuropsychological assessment, but also the psychiatric assessment. We know today that the incidence of co-occurring primary psychiatric conditions is rising. And we need to be able to treat the whole patient so they have a better outcome. So we offer a lot of specialty testing upon admission at Care in Ocean Drive, which would include the normal, like the biopsychosocial spiritual questionnaires and the history and physical, but then we do an addiction medicine evaluation, a psychiatric evaluation, a neuropsychological evaluation that looks at both cognitive functioning and personality structure, and then a pharmacogenomic evaluation, which actually looks at the patient's genes and what medications would work best for them, because we're really good at what we do and we're very thorough.
Now I have the honor and privilege to introduce three key members of our Ocean Drive team. I've worked with these individuals, some of them for well over a decade now, and I'm just so excited to introduce them to y'all. So first we're going to start with who you saw in our video, Dr. Phoenix Adams. He is Caren's Senior Vice President of Signature Programming, and utilizing his 30 years of business experience and 10 years of clinical experience, Dr. Adams provides oversight of the Florida Continuum as well as Grandview and our older adult program in Pennsylvania. In addition to having a really big title and being an overachiever, Phoenix is one of the most kind and sweet and helpful human beings you will ever meet. So always a pleasure working with Phoenix. And then next we have Dr. Barbara Krantz, who's our Director of Addiction Medicine at Care in Florida. She has more than 30 years of experience in the recovery field. She's a member of the American Medical Association, the American Medical Women's Association, American College of Family Practitioners, American Osteopathic Association, and American Society of Addiction Medicine. So she's a member of a lot of things. She's obviously incredibly brilliant. She is truly the most humble and amazing, not just physician, but people that I've ever met. She is the person who I would trust to treat anyone in my family, incredible bedside manner, but also she's just brilliant. So we are very blessed to have Dr. Krantz on our team. And finally, we will welcome Josie Tynes. And Josie is our Executive Director of the Florida Continuum. Josie oversees clinical and administrative operations for Caron Ocean Drive. She provides support and supervision to clinical and operational staff and building relationships with clients, families, and referrents. For those of you who've had the opportunity to work with Josie, you know what I'm talking about when I say if there's anything to get done, Josie gets it done. She is amazing, and we're just very fortunate to have her as well. So thanks to all of you for being with us today. And first, we're going to start with Dr. Phoenix Adams, who will reiterate and add to the general overview that he provided in the video. I'll turn it over to you, Phoenix.
Thank you so much, Kelly. It's so exciting to be here today to connect with everyone, even though it's over a digital platform. I'm very happy to be able to be in our 10th year at Ocean Drive and to still be here talking about where we've been, how we've evolved, and where we're continuing to go as an organization. And I've been with Caron for more than 10 years, so since the inception of Ocean Drive. So it's exciting to be where we are today. As many of you know, and this is really in response to a lot of questions that I get, people tend to ask me, well, why Ocean Drive? How did it evolve? People that are really familiar with what we've done in Florida at Caron Renaissance for all these years. And one thing that I highlight is that the conception of Ocean Drive really started with our family work. And as many of you know, family work is the cornerstone of the treatment work that we do here in Florida. So our Florida programs are really known for that. More than 10 years ago, when we were looking at the work that we do with families and realizing that, through programs that are, very clinically intense, like our residential family restructuring program that we have at Renaissance, where we involve families to be in treatment alongside with their identified patient, we began to see a lot of generational themes transmitting from one generation to the next in these family systems. And so many people within these family systems were untreated for their own mental health concerns, their own substance use disorders. So we wanted to find a solution to be able to address those clinical needs for these family members. But we asked ourselves, well, if we're noticing that it's been going untreated, then why has it gone untreated? And what are the barriers that would prevent these types of individuals from getting the help and the support that they need? So we began to look at what were these barriers, what were preventing them from access to care. We knew things, were issues like people, if they wanted treatment, they'd need the ability to stay connected to work. They need a way to stay connected to family while in treatment. And we also looked at the profile of the family members, the individuals that we were going to be treating if we were treating the parents or grandparents and family members of our Renaissance patients. And we identified the need to provide a treatment experience for these individuals and their families that was really more consistent with how they lived outside of treatment. So while we were a very life skills based program at Caron Renaissance, our family members that would need treatment, they have quantifiable success in their lives. They have success in areas, academically, financially, professionally, but they're still struggling with their mental health or substance use disorders. And it threatened to impact their business, their relationships, and their well-being in general. So we knew that if we wanted to treat them, we had to provide a treatment environment that these individuals could receive care that paid special attention to discretion, privacy, confidentiality. We knew that our patients would do better in a smaller community with more individualized attention, and to be with people, from similar backgrounds, with like-minded individuals with similar experiences, to offer that support and that reflection, that understanding that comes with being with people with like experiences, so that all can be reflected back to them. So that's where we are now. We've evolved since the inception. I know Josie's going to talk a little bit more about the clinical end of the program, but I'm looking forward to all of your questions and being able to answer them as well.
Thanks so much, Dr. Adams. Next, we'll hear from Dr. Barbara Krantz, who will speak to the medical acuity that we're capable of treating at Caron Ocean Drive. Dr. Krantz?
Thank you, Kelly. Well, essentially, there isn't anything that I am aware of except maybe acute suicidality or being very pregnant that we haven't been able to help the patient medically here at Ocean Drive. We understand that substance use disorder is a progressive disease, and with that comes a lot of co-occurring medical diseases. So we will deal with insulin-dependent diabetes, we'll deal with chronic pain, we'll deal with cardiac arrhythmias. We've had many patients with active, even end-stage cirrhosis, as well as patients that need dialysis. We have a very good team and collaboration within the community. We work with the Cleveland Clinic and are able to refer patients for very specialized medical care when needed. So again, I don't think there's anything medically that we haven't been able to handle.
Thank you for that. Now, Josie will give us a deeper look at the typical profile of an Ocean Drive patient, as well as she'll explain the treatment modalities we utilize a little more, and also talk about the elegantly appointed facilities we have, and discuss how we work with families. Josie?
Thanks so much, Kelly. Thank you, Phoenix, Dr. Krantz, and most importantly, thank you to all of our guests today for coming to the open house. You know, your support is tremendous, and we absolutely appreciate it. So to start, I want to discuss a little bit the typical profile of an Ocean Drive client. So Ocean Drive clients are generally individuals of influence and affluence. And what I mean by that are, you know, some of the types of individuals that Phoenix mentioned earlier, those who are in the entertainment industry or higher profile in business, executive types, and also individuals who come from families or themselves need a level of discretion. Confidentiality is something that's of the utmost importance to us as a team at Ocean Drive, and also looking at the type of a lifestyle that individuals are generally accustomed to. So ensuring that our residences, our culinary team, and our ancillary providers are able to provide amenities similar to those that individuals would experience outside of their treatment at Ocean Drive. The primary purpose of that thought process is to really alleviate any kind of external stressors so that Ocean Drive clients can focus on their clinical care, which we believe is absolutely paramount to any kind of, you know, treatment that we provide. It's, you know, one of the things that I love about Ocean Drive is that we're able to provide the amenities and we continue to have clinical integrity concurrently with that. Looking at some of the common treatment modalities that we use, as you all heard in the initial video, cognitive behavioral therapy, dialectical behavioral therapy. Some of our trauma work looks at polyvagal theory, also looking at narrative therapy, EMDR. We're really big on the multidisciplinary team, which I'm going to tie into our ancillary services as well. So we have Dr. Krantz, who's our Director of Addiction Medicine, Phoenix, myself, Dr. Anthony Campo, who is our Medical Director and Board Certified Psychiatrist. We have Dr. Yanula Alexakis, who is our Director of Neuropsychological Services, Allison Steiner, who does neurofeedback, and we have 3 primary therapists, 3 family therapists, one of whom is the clinical director. We also loop in our ancillary providers to that team and to our rounds. So as clinically indicated, individuals who provide breath works, who provide therapeutic massage, acupuncture, equine-assisted therapy, Reiki, somatic experiencing. We really want to make sure that there's a thread that is tying all of our services together so that clients are able to receive seamless care. And, you know, I haven't worked or seen anything quite like what we're able to do as far as the expansive knowledge of our team at Ocean Drive. Finally, I want to touch a little bit on our family programming more in depthly than, you know, was previously discussed in the intro video. We have 3 main family treatment programs. One is our residential family program, where family members, which could be partners, spouses, could be children, adult children, business partners, you know, romantic interests, friends, really anyone who the identified client deems to be important as part of their family system, is able to actually come and participate for a week or 2 weeks in our treatment process and live on our property and be a part of the Ocean Drive clinical milieu. It's an unbelievably rich clinical experience that provides tons of opportunities to see how people interact. It also allows us to have individuals, experience family dynamics firsthand with clinical support prior to returning home. Another clinical intervention we have for families is a clinical impact visit, which is similar to the residential family program, but shorter in nature, 1 to 3 days, where participants would be living off property. And then finally, we have our family workshop where families will come and participate in groups and individual sessions with their family therapist and primary therapist and identified client. And that is where families also live off property and engage in clinical and holistic services.
Thanks, Josie. Now, before we move into Q&A, just as a reminder, if you do have questions, I know a lot of you have already submitted them. If you do have additional questions that haven't been addressed thus far, please use that Q&A feature in the bottom right-hand corner of your screen to submit a question, and we will get into those in just a moment. I just wanted to speak briefly on what it looks like from an admissions perspective to come into Ocean Drive, and also the case management side of things that we are very proud of, that I feel our team does an incredible job with. As you can tell from the video and from hearing Josie and Dr. Krantz and Dr. Adams speak, this is a very specialized, customized program. So we want to make sure it is the absolute best fit. So when folks call in, whether it's the referent, the patient themselves, their family, one of our amazing case specialists does a very thorough job of going through the clinical components of the program, but also we're very blessed to have the 3 individuals who are part of this webinar, as well as some of the other folks that Josie mentioned that make up the multidisciplinary team. And all of them are wonderful about getting involved in admissions from the very beginning. So if it's a case that has complex medical acuity, as I was saying Dr. Krantz's praises earlier, she is always happy to speak with referring physicians or therapists or the patients or families themselves to really talk about what's going on medically. She will review their medical records to make a determination to make sure that we can, in fact, treat them successfully, as she mentioned earlier. Besides the super pregnant folks, as well as obviously anyone experiencing thoughts of hurting themselves or someone else. We have taken some very complex medical cases, but we don't take that lightly. And Dr. Krantz does an amazing job of going through those to ensure that Ocean Drive can ultimately meet their needs. If we need to set up dialysis, whatever that looks like. So we do that piece from a clinical perspective. Both Josie and Phoenix are incredible clinicians who are great about looking at what has the person tried before, what worked, what didn't, what are the family's expectations, what are the barriers for them to actually be able to focus on treatment. We want everyone to be able to achieve recovery for life. So from the very beginning in rounds, the entire treatment team is looking at, can we help this person? What would that look like? And just making sure that everyone's clear on what our expectations are, as well as what are the patient's expectations and the family's expectations, to make sure that we can, in fact, give them the best experience. So we follow that through from the very beginning until the person lands with us. And then on the other side of things, once they're completing treatment, we have an amazing alumni department and continuing care service so that we make sure that their recovery continues, whether they're staying in Florida or returning home, wherever that may be. And we feel that they're always a part of Caron. So we very much value and appreciate and honor our alumni, and they are welcome to come back at any time and participate in progressive recovery workshops, come down, see their team, get together with themselves. So it's a really specialized program that we're just honored to all be a part of, and it's exciting to watch that piece happen. So now we are going to move into the Q&A feature. I know a lot of you have submitted questions, and just so you know, if we run out of time to answer all of them, someone from our team will follow up with you. We want to make sure all your questions get answered. So the first question I have here, Phoenix, I will actually direct this one your way. And I know this was discussed a little bit, but can you elaborate on the benefits of what we call the Florida model, and also touch on what type of oversight is provided at the residence for our clients?
Sure, Kelly, thank you so much. So the Florida model specifically, we're set up so that our residences are separate and distinct from our clinical offices. So they're in separate locations. So really there's a feel that you have a very intense clinical workday, and then you're able to return to a familiar, comfortable surroundings that resembles home. So you're able to, decompress after hours in a different way than you would if you felt like you were sort of in that treatment bubble the whole time. Some of the benefits that go with that is that we're able to provide more of a life on life terms experience than just the experience that you get when you're contained in one campus. So COVID notwithstanding, because that has changed, a lot of the way that we have had to do business, like most of us over the past year and a half. But as we're returning to a sense of normality and able to incorporate more of life's terms into treatment, we're able to bring our patients outside of the home. They're able to, go for a walk if they need to go for a walk, if they want to go for a walk, ride a bicycle, go to the beach, do some things that, nurture their souls, and take care of their spirits as well. But also gives them the opportunity to, obviously we have a very intense clinical day. Our patients that engage in 12-step work or support groups will do that outside of our clinical day. So they have the option and access to be able to do that. Again, the Florida model also allows for connecting with work, having family involved, having family visits. We like when family members do come for a visit, but we also don't want that, all the time just for the sake of a visit. We want to have that as part of a clinical interaction. So family members that are staying in the area, we can set up clinical interaction, and we can set up time after hours as well. So that's really what the Florida model lends itself to.
Thank you, Phoenix. Josie, this next question I'm going to ask you, since you touched on it earlier. The question is, can you please expand further on the trauma modalities that you are using?
Sure. Thanks, Kelly. That's actually a great question. So I want to tie this into our length of stay a little bit. And I know, hopefully we'll get to talk about length of stay more in depth a little bit later, but we use a variable length of stay format. Our program recommendation is 56 days. And part of that is so that we're able to do some of the intensive trauma work that we really pride ourselves on at Ocean Drive. So specifically with the population of Ocean Drive clientele, we found that trauma, either developmental, relational, or shock trauma, is a part of almost every individual's life who we encounter, who steps through our doors for treatment. So what we really do is look at the medical components of treatment with Dr. Krantz and Dr. Campo, the clinical components with the clinical team, and also looking at, the spiritual and vocational components as well to see what trauma modalities are most appropriate for each individual that we treat. A lot of the time we'll utilize EMDR in conjunction with narrative therapy and some group modalities as well. We increase our individual sessions generally for clients who are working on trauma. We also are utilizing polyvagal theory and the Safe and Sound protocol. We also implement somatic experiencing, Reiki, breath work. So having our practitioners that provide those services, in addition to therapeutic massage, to look at that mind-body connection, collaborate with our clinical team so that the work is able to be taken out of the clinical office and into, sometimes an outside environment, whereas those of who are clinicians, sometimes the magic happens actually outside of the office. So we want to make sure that we're able to collaborate with our ancillary providers on that. And finally, I want to highlight equine-assisted therapy, which we utilize on an individual and a group basis, which we found has been tremendously helpful in relational trauma and developmental trauma, and looking at, treating personality disorders or personality structure that can be maladaptive as a result of trauma, concurrently with, some of the more didactic or process-oriented work that's done in the treatment space.
Thanks, Josie. And you actually segued into the next question that came in, which is about how, as we all know, oftentimes trauma and access to diagnoses can go hand in hand. Can you elaborate a little more on specifically how we address and treat personality disorders at Ocean Drive?
Absolutely. So I think first and foremost, it's really important to identify the differentiating factor between treating a personality disorder and labeling or pathologizing someone with a personality disorder, because they're two very different things. And I think in order to have someone successfully enter into recovery, whatever that is from, be it substance use disorder, any kind of process disorder, or a mental health concern, we want to look at what are the primary drivers for their maladaptive coping process. Oftentimes we find that personality disorders or maladaptive personality structure, maybe not even falling into the disordered range, is something that inhibits our clients' ability to develop close relationships with either family members, supports in the community, or friends. And as we all know, the opposite of addiction is connection, right? So we want to look at, from a relational perspective and from a interdisciplinary perspective, how can we medically, clinically, and holistically treat personality concerns and help our clients through a corrective experience with their relationships with the Ocean Drive staff in, behavioral redirection and relational and clinical redirection when some of those maladaptive personality features show up in the clinical space.
Thanks, Josie. This next question that came in, I'm actually really glad it did. I feel like this is something that comes up a lot and we honestly don't talk about very often in the treatment world. So Phoenix, I'll actually send this one your way. I've heard you speak on this topic before, but the question is, in my practice, I see clients of means along with generational wealth and family business. However, they've frequently been told their problems can't be that bad and to humble themselves. Do you find these patients lack trust with their treatment team for fear of judgment? I think that's a great question, and I'll send it your way, Phoenix.
Yes, yes, and yes. So I think that trust is such a big issue, and not just for someone to come in and trust their treatment team, but often we work with patients that have been exploited by other people. They're surrounded by sycophants, people that want them for what they can gain by associating with their wealth, their notoriety, their power, their influence, right? So, I mean, a lot of the patients that we work with are not sure, who's in it for them or who's in it for the benefits. So I think rightfully so, there are a lot of trust issues there. And I think the fact that they're relegated to, well, you're a person of privilege, or whatever's being told to them, like your problems are not that bad, is just really a sad commentary, because we see so many people that have suffered, just through family of origin, through grief and loss, through traumatic events, and they might be wrapped in different packages, but certainly as worthy of attention and support and love as anybody else. So I think that, when looking at anybody, whether they're from means or not, it really is about, as Josie said, making a connection and building, a trusting relationship, giving somebody the opportunity to walk through the door and understanding that maybe they're not going to trust their clinical team from day one. But at the same time, I think that, what do we say to patients and family members about, about change? And, when do your family members start believing that you've changed? When they see consistency over time. When our patients come to Ocean Drive, we model that same premise that, we're consistent as a staff, we're supportive, we're loving, we have clinical acumen. So we provide the patients with what they need, but we also do it from a relational perspective where we're able to get in and build relationships, but also not judge somebody for who they are or where they've been, but to look at everybody as an individual and figure out what are their unique issues and how can we help make change for that.
Thank you for that, Phoenix. The next question, I know something that comes up a lot is, we all know there are the people that we say they truly feel like they can't go to treatment versus the ones who just won't go to treatment and look for any excuse to use as a reason for why, now is not a good time. In my 16 years in this field, I've yet to find a time where it's like, oh, it's actually a really convenient time to go to treatment, right? That never happens. But some excuses seem to be more valid than others. And the one that comes up frequently with the Ocean Drive clientele is that of work. So for those who truly have commitments, both personally and professionally, what is Ocean Drive's policy as it relates to allowing them to access work, for that to be part of their treatment day, with the understanding that obviously the focus needs to be on treatment itself? So Phoenix, why don't you take that one, as it's on a similar note to what you just got done answering?
Yeah, it is similar, but I can, expand on this, Kelly, because it's still a great question and, very important to discuss. I think that, so often we see people in that contemplative or pre-contemplative stage where they know they want help, but they're really afraid to get it, or they're evaluating all of the other barriers that, are sometimes the very legitimately important things that might become reasons or excuses for not getting the help that they need. So the question always is, well, what if you don't do this, right? But, we will invite our patients, typically we ask for 28 or 56 days, or, we find that treatment works best in a 56-day model of care, but, some will stay 28 days. For those that do have things going on in their life that they've got to be present for, it could be the birth of a grandchild or a child, it could be a particular board meeting that they have to be at. We find ways of being able to support our patients through that, so they are able to, obviously we want their clinical day to be the biggest priority, but obviously we also don't want somebody's life outside of treatment to continue to deteriorate because there are things that really need attention. So we try to find a balance. So we do build time into the day for individuals to connect to work if they want, but for those bigger or larger events, at the appropriate clinical time, we can support what we call a personal leave. And we can do that in a number of ways. Someone might be 2 months into their treatment and be ready to go off on their own, which is also a great way of assessing, well, what happens when you go home and what happens when you're back in that environment and exposed to all of your triggers, then come back and process it in treatment with us. Or it might be, let's see how this works, and we send you with a sober companion or support. There's lots of ways to do it, but again, this is the importance about bespoke treatment where we really individualize care and we look at, what is appropriate for this particular individual at this time. And, I think we want to be transparent and have those conversations up front so that our patients are aware of this through the admissions process. But also, I, spoke a little bit, I alluded to, the clinical integrity that we have with the program. And part of that is being able to say, okay, you know what, if you're not sure, come on in. Let's have a visit with us or come and stay for a couple of days. If you started Ocean Drive and we're not what we say we are, or this is not going to work for you, happy to refund your money, because it's not about money. It's about the clinical care and it's about getting people the help that they need. But sometimes they need to see that firsthand and come and meet us and see we are what we say we are and we'll do what we say we're going to do. And that's the piece about having integrity.
Thanks, Phoenix. Actually, on that note, you had mentioned about the clinical integrity, and another question came in that's also a great question. Y'all are full of great questions. It says, programs like this seem to cater more to the patient enjoying their stay rather than focusing on treatment and boundaries. How does Ocean Drive maintain its clinical integrity and not let the patient dictate treatment? So I'll actually just send that one your way as well, Phoenix, so you can finish those profound thoughts you were making.
Great, I'm on a roll. I like that question because it does get asked a lot. And, I think one of the things that we've always prided ourselves at Ocean Drive is that, we really stand on the shoulders of our predecessors that built, treatment models that, were, amenities based, some were more clinical than others, but, there were treatment models that did cater to this particular population. I believe what we've added to those models is a very, very intense clinical component. And while we know that, some of our patients, yes, do they come in looking forward to a therapeutic massage, breath works, other ancillary services? Yes, they do, absolutely. But we're not providing them just specifically for that reason. We're providing them because they're complementary therapies that are proven to work really well in conjunction with the intense, clinically robust treatment that we offer. So somebody that is feeling better and calm and centered and is breathing and working through their traumas in those ways also is very, very helpful to the clinical process. So if somebody wants to come to Ocean Drive thinking that we're just a spa retreat, then we're probably not the right treatment center, because we do have that clinical integrity. And we talk about that very early on from the admissions process so that patients and their family members know exactly what to expect. They know that they're getting a primary therapist. They know that they're getting a family therapist. They have 2 therapists dedicated to their clinical treatment, plus a whole team of other therapists, doctors, neurofeedback technicians. So you can't really escape the clinical work when you're here at Ocean Drive. But I think the other thing that I think is beautiful about your question is, as far as being able to maintain our clinical integrity, our patients do a lot of that work for us. And, when we spoke about why is a treatment center like Ocean Drive needed? Do you really need like-minded, like-experienced individuals from similar backgrounds? I would say the group work that we do here is equally as intense and as important as the individual work that we do, because in the group process, and that's why we call them process groups, when you're processing those feelings, those experiences, that emotion, all of those things that lie underneath the problematic behavior, that lie underneath the substance use disorders, there are other patients that have gone through the same things and can see exactly what's happening, and will call it out, and will hold our patients accountable and say, man, that's not right. You need to look at this in a different way. So the patients really do a great job of keeping each other accountable to their clinical work.
Thank you, Phoenix. All right, now we're going to switch gears a little bit. So everybody put on your science hat. This next question I'm going to direct to Dr. Krantz. No offense, Josie or Phoenix, but I'm going to send this one her way. The question says, there was a mention of neurocognitive testing. Can you elaborate on this? And I know, Dr. Krantz, this is your baby, so I know how much you love and enjoy this. I'm excited to hear your answer. Oh, you muted yourself. There you go.
Am I unmuted now?
Perfect.
So I have a brain, not really good with IT, but no, this is, for me, this is one of the most exciting things that we're able to deliver at Ocean Drive. Because we know, again, I've been in the addiction field for a long time, 30 years, 30 plus years. Addiction medicine has kind of at least come up to the brain era and quantum physics, and we have a better understanding that the target organ for this disease is the brain. So if you look at everything you experience, everything you respond to, all of that is shaped by our thoughts and our emotions, and therefore then our behavior, like Phoenix was alluding to also. So it is critically important that we look at the brain. It is critically important that we assess what's going on in the brain. And today we have that ability. At Caron Ocean Drive, we use many modalities to assess the brain. So when the patient first comes in, they're going to have the regular assessments, history and physical, addiction medicine, psychology, psychiatry. But more than that, when we're looking at the neuropsychological testing, we will do a cognitive proficiency testing with the R-bands, and we've had to use models that will capture any intellectual deficiency, because most of our patients are very smart. I mean, their intellectual reserve is there, so they may not even be aware of the effect that their substance has had on them. We all know that alcohol itself affects frontal temporal lobes, so it's going to affect memory. So we do that assessment, and then as Josie and Phoenix talked about, we'll do the personality structure. It's their own self-report. So we'll see if there's anything maladaptive in their behavior, because again, personality is going to be part genetic and part everything that we've lived through, and whether it's maladaptive, we need to know that so we can help tweak it. Or the patient can help change that to something that's working for them now, and not be in that survival mode that they were as a child. So we look at the brain, we do neuromapping, which is brain waves, and that follows actually child development from delta all the way through beta. So you have a patient coming in that has, is paralyzed by analysis, so to speak. So we're going to see in color, in real life, their QEEG. We do a quantitative EEG that's computer printed, and then actually gives us color with standard deviations away from the normal, that tells us if that patient is like excessively ruminating, or if there's a depression that they weren't aware of, or if their limbic system, the emotional seat of the brain, is not speaking to the frontal cortex, the executive functioning, critical thinking, forward thinking, impulse control. So we have all of those modalities available to us. We also do neuroimaging. Again, that has been very helpful with technology now, whether it be functional MRIs or SPECT scan or SDG PETs. We have a lot of patients as they age, they're worried about dementia, or we may pick up a abnormality on the R bands with cognitive deficiency, so we can go a step further and actually see blood flow, because regular neuroimaging will only give structure and it doesn't give all the function or perfusion data. So we can do that, and then we have modalities that will actually treat it, whether it be neurofeedback, whether it be alpha stim, whether it be hyperbaric oxygen, which is oxygen under pressure. We have seen miraculous, results, in the sense we had a patient that had was one of the first patients I saw at Ocean Drive, a young girl, probably in her 40s then, that had had an accident and her head was crushed, and she survived that. However, her intellectual functioning wasn't there, and she had a higher incidence. Obviously, brain trauma has a higher incidence of substance use disorder. So when I first met her, I was like, oh, this is going to be an interesting case, because she wasn't, putting the dots together, so to speak. So we did all of our assessments, was able to use SPECT scanning with her, pre and post, and neurofeedback, which helps the connections in the brain literally connect to each other, and hyperbaric oxygen. And when I saw her at the gratitude dinner, it was night and day. But we have many examples of that, whether it be chronic pain or cognitive decline, or just, really stuck in adverse childhood events and trauma, and I think that's the very, very special thing about Care in Ocean Drive. I've been around the block a while, and I've worked at other treatment centers, but we are so team-oriented, and we have the capacity and the ability to really look at a patient individually and be able to assess and then treat. So I am very grateful for the team members here, and for being able to work at Ocean Drive, because miracles really do happen. That's not an exaggeration. You may not know me, but I don't exaggerate. This is a very exciting place to work, and we see people with all the modalities that we use and are able to use, change, and their life is so much significantly better. And I'm sure all the therapists out there, have the same experience with their patients, but
you, Dr. Krantz, and we are grateful for you and your ability to explain all of that in a way that my non-med school brain can understand. So thank you.
You're welcome, Kelly.
Phoenix, this is also a question that we get asked frequently. Do you have to have a substance use disorder in order to be a candidate for Ocean Drive?
So in short, the answer is no. We do have specific beds. So we're licensed by Department of Children and Families in Florida, but we also have beds licensed under AHCA, the Agency for Healthcare Administration. So we can take individuals into treatment that have primary mental health disorders. Usually when we do, the substance use disorder is secondary, but personality disorder, mental health, process addiction, you name it, we're able to treat that, and the substance use disorder can be secondary.
Thank you, Phoenix. Josie, two questions came in. I'm actually going to combine them. I think you'd be a great person to answer both of them. One of them says, Josie, please elaborate on the family visits you mentioned. Are these in person? And then another one of our attendees would like to know if we take couples in treatment.
Sure, both great questions. So yes, the visits are in person. Thankfully, they are again. They weren't for a little while with COVID, but we're following CDC guidelines as far as screening and things like that. So we're able to safely have family members in person. And yes, we do treat couples. We will work with the referring professional as well as our team here to determine if it's best for couples to admit together or to have a staggered admission process, or to have one come first, one individual come first, and then the other come afterward and have a period of overlapping time. But we have treated couples in every variation of that kind of scenario that I mentioned before. So admitting together, admitting separately, family work in the middle, family work at the end, all of that we've done. And we love to treat not only couples, but we've also actually treated entire family systems too, which is pretty awesome.
Absolutely. On that note, a question came in wanting to know, are the Ocean Drive programs gender separate? So do you want to speak, Josie, just elaborate on that and talk about what we do for gender specific work as well as co-ed treatment components?
Absolutely. So we try as much as we can to keep our residences gender specific. There are times that we have overlapped. There's actually a separate house at one of the residences that's private from the main house. So if you do have an overlapping scenario, that's usually where we'll place individuals. However, we do have gender groups as well during the week, and our process groups are co-ed. And the reason for that is to build on what Phoenix said with the Florida model. We really want to look at life on life's terms and seeing how individuals who maybe had gender specific treatment, if that was warranted as their primary treatment, are able to look at the reintegration process during their time at Ocean Drive.
Thank you. A question came in specifically about Caron Renaissance. For those of you who may not be familiar, Caron has another program in Florida called Caron Renaissance. Josie is actually the executive director of both. So Josie, I will give you this question, and he would like to know, is Caron Renaissance a completely separate program?
Yes, Caron Renaissance is a completely separate program. And actually our programs are in buildings next to each other, but our clients at Ocean Drive don't overlap with our patients at Renaissance, except there's a shared medical suite. So they're completely separate programs with completely separate teams as well.
Thank you for that. One of the things I have loved though over the years is y'all's ability to get creative and work outside the box. And I know we've had multiple times where say a child is a patient at Caron Renaissance, and then one of their parents or grandparents are patients at Ocean Drive simultaneously. And I've always been very impressed with the amazing job that you're able to do, even though they're two separate programs, but you're able to treat that entire family system when one patient is at Caron Renaissance and one patient is at Ocean Drive at the same time. So the next question, and we only have just a minute or two left. And again, if we run out of time, we will make sure that we follow up with you. Oh, the last question is, they would like to know how many guests are in the Ocean Drive program at once. Josie, Phoenix, me, Dr. Krantz. I guess any of us could answer that. But who wants to go?
So I'll take that. Thank you, Kelly. So as Josie mentioned, we do have 2 residences, and we try to keep those gender specific. With the residence that has the separate gatehouse on the property, that's an 8-bedroom residence, and the other residence is a 6-bedroom residence. So the 6-bedroom residence is usually the female specific residence, and the other house is the male specific residence. So technically, at our highest level of care, we're able to treat 14 individuals at a time, which is a nice intimate setting for us as far as number of patients. We do sometimes have patients that will stay a bit longer. We have transitions in level of care where some clients might go to an IOP level of care, live off the property, and then come back. So that increases our numbers a bit, but not all that much. So 14 is really the magic number.
Thank you, Phoenix. And one more question just came in that I will just answer real quick. Says to refer to your program, do I need to refer through Grandview, which is one of our programs at Caron, Pennsylvania, or will you accept folks who have not matriculated through Caron, Pennsylvania? And the answer is yes, absolutely. You do not need to go through Caron, Pennsylvania in order to come to Ocean Drive. Some of our patients do start there and then come to Caron Ocean Drive or Caron Renaissance, but it's not a requirement. And we actually pride ourselves on working with a lot of great programs all across the country. So a lot of times patients start elsewhere and then come to us for extended care or vice versa. So you do not need to start anywhere in order to come to Ocean Drive. And now I just want to wrap this up and thank everyone so much for being part of this. I want to say thank you again to Dr. Adams, Dr. Krantz, and Josie for your time today, and for all of our attendees for joining us. Before we conclude, we want to share some additional opportunities coming up from Caron. Next month, Josie will actually be joined by Jonathan Salzberg, who is Caron's Executive Director of College Success and Career Services, and they will host a virtual CE presentation that's specific for professionals. And this program will be held on August 5th at noon. The topic is Family Business Dynamics, the Intersection of Psychology and Strategy. Webinar is complimentary and continuing education credits will be awarded. Registration just opened up, so you can go online now to reserve your spot. And additionally, we hope you'll join us next month for the final installment of our virtual open house series with Caron's Grandview Men's Program. We'll provide an opportunity to take a virtual look inside the Grandview Men's Unit on Caron, Pennsylvania's campus, as well as meet our expert team and ask questions about our services there. So watch for additional details this month in your email. And finally, please reach out to your local regional resource directors regarding admissions to any of our programs, questions on our services, resources, events in your area. If you want to get connected with Josie or Phoenix or Dr. Krantz, anything at all we can do to be a resource to you or your clients, please don't hesitate to ask. And thank you again for joining us today, and we hope to see you again soon. Take care.